HIV prevention in the LGBTQ community. HIV statistics in the United States. According to the CDC, in 2019, an estimated 1,189,700 people living in the United States was HIV positive. 100 people surveyed, 87 out of those 100 knew their HIV status. 76 had received some HIV care, 58 continued HIV treatment, and 66 were considered to be virally suppressed. HIV statistics and prevalence in the LGBTQ community. Researchers show that in the LGBTQ community, gay and bisexual men are the population most affected by HIV. According to the CDC, in 2019, there were 36,801 new HIV diagnoses in the United States. 69% of them, that's 25,552, were among gay and bisexual men. Anal sex is considered the riskiest types of sex for getting or transmitting HIV, placing gay and bisexual men in the highest risk population. Gay and bisexual men have a higher rate of known HIV infections compared to any other group. Therefore, they have an increased risk of having a partner with HIV. Studies have also shown that PrEP use among bisexual men continues to be low. I mentioned on the previous slide, one of the reasons that gay and bisexual men are the highest risk population was that their use of PrEP was so low. This is a 6-minute video off of YouTube interviewing and explaining why the use of PrEP is so low among gay and bisexual men.
We're coming into contact with a wide variety of attitudes and opinions about PrEP, ranging from those who don't even know about PrEP, which is really surprising to me, to hostility around the fact that no, we shouldn't be doing this. The manufacturer of the drug, Gilead Sciences, has decided not to advertise it.
The doctor said, well, you shouldn't do that, you should use condoms. Because there still is a lot of homophobia in the medical system, including from there may be some gay doctors who think that gay men should always use condoms.
Hi, this is Nick Casimir with Daily Extra. Welcome to the 4th part of our series on pre-exposure prophylactics, otherwise known as PrEPs. The promise is great, a pill you take every day that prevents HIV transmission. Early studies are encouraging, but uptake among gay men is surprisingly low. As a nurse here, and I mean, we're in the Castro, where gay men come in all the time and inquire and ask you, how many people ask you about PrEP?
On average, between 5 and 7 patients a week. Right now in this clinic, I'm seeing roughly 14 to 15,000 patients a year. They're coming here to get the information first because this is what we do. We are a sexual health clinic.
Oftentimes you have guys coming in who may want to talk to the doctor about PrEP, but they don't know how to talk to the doctor about PrEP because either they don't see the primary care doctor that often, or they try to talk to the doctor about PrEP and the doctor didn't know about it, or the doctor said, well, you shouldn't do that, you should use condoms. Because there still is a lot of homophobia in the medical system, including from there may be some gay doctors who think that gay men should always use condoms. So I see it in our job is to do some education to the patient about how to be their own advocate with their primary care provider.
Only 6 to 8 people a week come and ask about PrEP, which is a very small stat given the influx of people that come in here.
Part of it is that there's not been a lot of education outside of the research world to talk about PrEP, right? The FDA approved it, so Truvada's been approved now for use as for PrEP, but there's not yet been a lot of campaign talking about that. Gilead, who manufactures the medication, has said they're not going to do any direct-to-consumer marketing about this. This is not they're not pushing this.
Why
right?
not, you think?
Because they don't want to be accused of being in it for the profits that are associated with it, which is what AIDS Healthcare Foundation has largely been critical of, is the profits. And Gilead is saying, look, we're not going to do that. We're not doing direct-to-consumer marketing about it to tell people that they should take it, because it's up to the individual choice level for people to choose whether or not they want PrEP.
We see ads all the time for drugs of every kind, not just for HIV treatment drugs, of happy couples leading normal and happy lives, and we see them for everything from birth control onwards. But for PrEP, there hasn't really been anything. Why is that?
Well, the manufacturer of the drug, Gilead Sciences, has decided not to advertise it. So that's why it's not advertised.
Do you know why? What is your take? Isn't it? It's sort of like a valuable tool by the sounds of it, and very effective when used correctly with the right person. Why is it not advertised?
I think that they're relying on other people to promote this. I think that they think this should come from the community and healthcare providers rather than from their company. Their company is very successfully devoted toward treatment of viral illnesses, hepatitis C and HIV, and that is their focus. I think the prevention use of these medicines is something that they've supported to the extent that they've donated drug and placebo for the clinical trials, but they have not provided funding for the research, and they are not funding the advertisement of these drugs. And that's a decision that they made based on their discussions with stakeholders and their perception that this, if it's really going to work, has to come from community demand and health providers. The lack of awareness around PrEP. We've had conversations with AIDS service organizations around the country. We're trying to put together a resource guide, and we're coming into contact with a wide variety of attitudes and opinions about PrEP. Ranging from ASOs who don't even know about PrEP, which is really surprising to me, to hostility around the fact that no, we shouldn't be doing this, or because we need to take care of HIV positive people first, that should be where we place the funding.
Do you think some of the resistance of people to accept PrEP in some practice or talk about PrEP is a moral issue? Is this whole idea that we're opening up a Pandora's box again of sexual promiscuity?
I think that's part of some people's concerns. I think we've seen concerns about changes in sexual practices, what you call promiscuity. We've seen those concerns time and time again. In this particular case, we found that people who received the pill, and even people who thought it was working and thought they were getting the real thing in our studies, they tended toward having safer behavior. And so we didn't see this wildfire of sexual promiscuity. In fact, we saw the opposite. People tended to be safer. And so we in some people, we saw condom use increase. We saw discussions about HIV testing results increase. We saw a community form around HIV prevention. And, I think that people do get over it. I mean, in the end, we really, really do not want to get HIV. And I think that is an overriding concern. And I hope that people can get over their anxiety about sex that comes up every time there's something that may enhance sexual health.
This concludes our 4-part series on pre-exposure prophylactics, but the discussion on PrEPs has just begun. Please log on to dailyextra.com, our Facebook page, or our YouTube channel. Stay connected, and before making any decision concerning your health, please consult with your healthcare professional.
Assignment. In 2019 to 2020, the CDC sent out a report, which was considered one of the most comprehensive surveys up to date, of transgender women in 7 US major cities. 42% of the transgender women that were interviewed had HIV. 4 in 10 of those transgender women have HIV. 2/3 of the African American transgender women have HIV. And 1/3 Hispanic Latino transgender women have HIV. This alarming increase in the prevalence of HIV has created an urgent need for more HIV prevention and treatment services in the LGBTQ community. So many communities are implementing HIV prevention initiatives. So let's stop HIV together. How can we prevent HIV? As a society, there's such a stigma that is associated and attached to HIV and the discrimination against patients with HIV. If we let go of that stigma, then we would have more men and women more comfortable reaching out to their healthcare provider for the treatment and prevention they need. As a community, we need to increase education on the risks of the HIV transmission and prevention. As a patient, know your HIV status by getting tested regularly. Practice safer sex with the use of condoms. Practice monogamy. And discuss with your healthcare provider the use of prevention medication for HIV.
What is PrEP? PrEP stands for pre-exposure prophylaxis. It involves a person who doesn't have HIV regularly taking an oral pill that helps reduce their risk of HIV infection. And it takes some time to get the right levels of PrEP into your system to be properly maintained, particularly if you think you might engage in more riskier sexual encounters. If you intend to have receptive frontal sex, you need to take PrEP every day for 1 week before and 1 week after sex. The medication takes longer to be absorbed into vaginal tissue in comparison to the rectum. If you intend on having receptive anal sex, there are 2 ways you can take PrEP. You can do it daily or an on-demand. For most people, taking it daily gives them a better peace of mind that they'll have enough medication in their system to prevent an HIV exposure, even if they end up missing a dose. However, some people may prefer to take it just ahead of having sex, especially if you're not having sex regularly. This is sometimes referred to as an event-based dose or an on-demand dosing, but it's important that you know how to dose properly and your chosen way of taking it. How does it work? Well, PrEP is a pill that you take once a day. It may take up to a few weeks to achieve maximum protection, roughly 7 days for anal sex and 21 days for vaginal. But as long as you keep taking your PrEP, you can lower your risk of getting HIV by over 90%. Is it safe? PrEP has been shown to be very safe. However, with any medication, there can always be side effects. For example, some people have temporary side effects such as upset stomach, nausea, and loss of appetite when starting PrEP. How do I get PrEP? Well, to get it, you do have to see a healthcare provider and get a prescription. While you were using PrEP, you will need to check in with your healthcare provider every 3 months. To locate a provider in your area, you can send an email to hivservices@gaycenter.org if you're interested in finding out more about PrEP. How much does it cost? And is it right for me? The cost of PrEP includes the cost of the medication, your medical appointments with your provider, and any lab tests that your provider needs. But there are a number of ways that you can get it. It's covered through your private insurance, through Medicaid, and it's also available for uninsured, both through the company that makes PrEP and your local health departments. But is it right for me? Most adults can safely use PrEP, but a doctor will need to determine whether there's any reason why you should not take it. And it is only for people who are HIV negative. What about condoms? Well, the CDC and the World Health Organization recommends using condoms along with your PrEP as best protection. Using condoms protects you from sexually transmitted infections. To find out more about the facts about PrEP, click on the video link below.
Myth: the earth is flat.
If the world was flat, then where would all the water go?
Myth: if you drop food on the floor and eat it within 5 seconds, it is okay.
My cats eat food off the floor all the time, but it doesn't mean that it's okay for people to.
Myth: if you step on a crack, you'll break your mother's back.
My mom is a strong, independent lady, but I still avoid cracks just in case.
Myth: most people can't afford PrEP, a pill that can lower the risk of getting HIV by over 90%.
PrEP does lower the risk of getting HIV by over 90%, and people can afford it.
Bust the myths, get the facts. Text PrEP to 69866 and receive personalized advice on getting PrEP.